Hello and welcome viewers. I hope you're doing absolutely fine. Nice to have you here again today. I will enlighten you all on a very sensitive topic today. Today's topic is peptic ulcer. But before then, did you watch our previous topic on ovulation? If you missed it, kindly watch it on our Facebook page. Now, back to the business of the day. Peptic ulcers are sores that develop in the lining of the stomach, the lower esophagus or small intestine. There are three types of peptic ulcers. They include 1. The gastric ulcers that occur in the inside of the stomach, esophageal ulcers that develop inside the esophagus, duodenal ulcers that occur in the upper and the first part of the small intestine known as the duodenum. Peptic ulcers are present in around 4% of the population. Peptic ulcers may result in complications such as internal bleeding, perforations or blockage of the stomach. Bleeding occurs in as many as 15 people with the condition. What are the causes of peptic ulcer? A peptic ulcer happens when a catarrh-like thing that covers the inner surface of the digestive tract, called the mucous layer, is washed away by acidic juice that covers the cell of the stomach lining. The digestive tract is coated with a mucous layer that normally protects against acid. An increase in the amount of acid or decrease in the amount of mucus can create a painful open sore. The major causes are Helicobacter pylori, like H. pylori, a bacteria that lives in the mucous layer that covers and protects the tissue lining, the stomach and the small intestine. The bacteria often cause no problem, but in others, it can raise the amount of acid, break down the protective mucous layer and irritate the digestive tract, producing an ulcer. The bacteria is transmitted from one person to another by close contacts such as kissing and also through unclean food and water. Frequent use of pain relievers such as aspirin and other NSAIDs such as ibuprofen, Advil, Motrin and others. Naproxen sodium like Aleve, Anaprox and others, ketoprofen. Another type of pain meds like acetaminophen will not lead to peptic ulcers. Risk factors associated with the conditions are smoking, drinking too much alcohol, upper abdominal radiotherapy, liver cirrhosis, and corn diseases. Eating a lot of spicy food and stress does not cause peptic ulcer, but they can aggravate the symptoms. The symptoms include burning abdominal pain, heartburn, nausea, fatty food intolerance, bloating and abdominal fullness, bloody or dark stool, changes in appetite, unintended weight loss, and vomiting of blood. Moving down to diagnosis. To make a diagnosis, a doctor may first take the medical history and perform a physical examination. The doctor will check for bloating in the belly and pain. To know for sure if there is an ulcer, the doctor may carry out an upper endoscopy. This procedure, the doctor inserts a long tube with a camera down your throat into the stomach and small intestine to examine your digestive system and look for an ulcer. If an ulcer is detected, the small tissue is removed for an examination in the laboratory. An upper gastrointestinal series called a barium swallow may also be carried out. For this procedure, you will be required to drink a thick liquid called a barium. This liquid will coat your digestive tract and make it possible for the doctor to view and treat your ulcer. Your doctor may recommend breath, stool, or blood test to determine the H. pylori bacteria are present in your stomach. This is done because the bacteria is a cause of the peptic ulcer. For an accurate assessment of peptic ulcer, contact us at Joas Medical Diagnostics. Now, let's discuss treating peptic ulcer. Treatment depends on the cause of the ulcer. Treatment will involve killing the bacteria completely, reducing the use of NSAIDs and helping the ulcer heal. If the bacteria are present, the doctor will prescribe a combination of antibiotic medication to kill them. These may include tinidazole like Tinidimax, amoxicillin like Amoxil, clarithromycin like Biaxim and others. Proton pump inhibitors, PPIs medication to block the stomach acid. Acid blockers such as ranitidine like Zantac, famotidine like Pepcid to reduce the amount of stomach acid released into the digestive tract. Medications such as sulfoxafate or carafate to coat and protect the lining of the stomach and the small intestine. We have come to the end of today's topic. I hope you're able to capture the most vital parts of this information, from the risk factor to the symptoms down to the treatment. So please, when experiencing any of the symptoms I mentioned earlier, please do not just conclude you have peptic ulcer, but go to the hospital for proper examining, or you can contact us and we will always be at your service. Thank you.